Hi ADN students. So I'm going to go ahead and release this screencast for you. This is going to be, we're going to talk about my syllabus here for 221. So I'm going to go ahead and start here at the top. This is going to be same time, Mondays 10 to 11:30, Wednesdays from 11 to 12:30. This is the first time I've taught this as a 90-minute class. I'm used to doing this in 3-hour blocks. The content won't change, but the breaks are going to. And I'm not really sure what you guys have been doing up to now, but my plan going forward is that I will lecture those 90 minutes. I don't anticipate giving you 10-minute breaks if the class is only 90 minutes. So that being said, I am going to be flexible on if you need to, get up and take a phone call or something like that. Just please be polite to your other classmates. Don't make a lot of noise coming in and out of the classroom. But we are going to be pressed for time a little bit. So again, 90 minutes I don't think is an incredibly long time to sit there. So that is my plan, is that we will lecture the full 90 minutes. And then no breaks are going to be had at that point. So I'm sorry about that. But again, these final 8 weeks are going to go very, very quickly. And you're going to want me to maximize the most amount of time that I can getting through this content. Here is my contact information. So my office is G218H. It's a big glittery blue M on the door. You can't miss it. I trust by now most of you probably know where all of our offices are, but if you don't for some reason, I'm the first one on the left when you go down the nursing hallway. The easiest way to reach me is going to be through email. That's my email address there. And then, of course, catching me during my office hours is of course, the best way to get face-to-face with me. Textbooks, we're going to continue using our McKinney book. That's where the bulk of my content is going to come from. But I also do want you in your pediatric ATI book. I do not want you to be utilizing it as your sole source for studying. If you do that, you will be missing a lot of important information. So I stress the fact that it is a supplement. Okay, I've heard of students who have tried to use the book as their primary source, and they have not done very well in course as a result of that. Okay, so please keep in mind it is a supplement, not your primary text. All right, in the program student learning outcomes, these should be exactly the same from OB, so I'm going to go ahead and go through those. So here is what I'm planning on covering the final 8 weeks. So the first thing on the docket is going to be health promotion across the life cycles. And basically, that's going to be your growth and development chapters. So I anticipate that this is a review for most of you or all of you, because I know we have this in our PN program. And I feel like most nursing programs have this at some point in there. So that being said, I do not anticipate lecturing that for you. That is something I would like you to cover on your own. The first week of class, I'm going to start in on physical assessment. So my expectation is that you will have reviewed these chapters prior to the first day of class. So you have all of spring break. I realize that it's spring break, but we have a lot of content that we have to get to, and the better you utilize your time, the better you're going to fare in this class at the end. So even if you do a chapter a day, just kind of get in there and look and see, well, what kinds of things do we have to address with the infant age? What kinds of things are pertinent to the toddlers? My first exam is going to be over growth and development, so you really need to get in those chapters and at least look them over during spring break. Because it is going to move very quickly once the first day of class starts. Then I'm going to get into physical assessment. I do have a video that I do show you on this. I don't usually show videos, but in terms of pediatric assessments, this is one thing that I do feel is important, that you can see an actual assessment done on a child. So I will actually show this in class. We will talk about communication also on that day, because there is some things that you have to keep in mind when you're talking to a pediatric. You can't talk to them the same way that we talk to our adult patients. So we will do some communication exercises. Chronic conditions, terminal illness, fluid and electrolyte alterations, and then we're going to get into the actual disease processes. So infectious disease, that's one of my favorite chapters. I like this one because this is the one that is basically the diseases that often occur when immunizations aren't effective. So measles, mumps, roseola. I'll talk about bacterial ones also. Immunologic alteration, that's going to be your HIV, also your hypersensitivity reactions. GI is a really large chapter. There's a lot of pediatric GI alteration disorders, so that's one that you're going to want to spend some time on. GU, we'll talk about nephrotic syndrome, glomerulonephritis, and then we're going to get into respiratory. And I think respiratory is one of, well, I know it's the biggest chapter that I'm going to hit on because it's the most common pediatric complication you're going to encounter. So we'll talk about asthma and bronchiolitis and croup and epiglottitis. We're going to talk about all those things. Cardiovascular, that one's special to me. This one's kind of hard for pediatrics though, because we got to talk about these cardiac defects. So what happens when the fetal circulation doesn't close completely and what kinds of complications you can see. We'll also talk about heart failure. We'll talk about rheumatic fever, Kawasaki's, and that's going to be the bulk of the cardio chapter. Hematologic, we'll talk about sickle cell, we'll talk about iron deficiency anemia. There's a whole entire chapter dedicated to cancer. I will hit on the ones that are the most prevalent in the pediatric population. Skin integrity or tissue integrity, that's your skin disorders. I really like that chapter a lot because it's gonna kind of make you itch a little bit when you see some of it. But we also got to talk about burns, and burns are a big thing with pediatrics. Musculoskeletal, we'll talk about fractures, we'll talk about clubfoot, we'll talk about some of the things we'll see there. Endocrine, the big thing is going to be diabetes. There'll be a couple other things smattered in there as well. Neuro is pretty good sized chapter. And then the last three we're going to talk about are going to be psychosocial, developmental disability, and sensory. That's going to be your hearing and vision. So as you can see, we have a lot to cover in this last 8 weeks. So it's going to be really important that you stay on top of pediatrics because it is going to move very, very quickly. All right, here are my modules. So I will have 4 exams, 1 per module, and I've got them pretty separated here for you. So again, module 1, that's going to be your growth and development chapters 5, 6, 7, 8, and 9. You're going to cover on your own. I will cover chapter 4, chapter 33 in class. And then I've also got your corresponding ATI chapters that go with them. Module 2, that's when we're going to start getting into the disorders. So we've got your fluid and electrolytes, infectious, immunologic, GI, GU, and that's going to be, that's not the right name for module 2. I'm sorry, guys. That should be pediatric system disorders part 1. I've got them into part 1, part 2, part 3. I'm not sure why it's labeled that way. So that will be the end of module 2. I've got your ATI chapters here, and then I've got your evolved case studies that correspond with this as well. So bear with me. I'm going to tell you what we're going to do with evolved case studies. Module 3, that should say pediatric system disorders part 2. These are the correct chapters. We're going to do respiratory, cardio, hematologic, cancer, and chronic condition or terminal illness. ATI chapters, the only things that are missing from these are actually down in module 4 for some reason. So if you want to cross these out down here, your organ neoplasms, your blood neoplasms, and your bone and soft tissue neoplasms, those should come up here for these corresponding chapters. I'm sorry, I thought I caught all these typos, so that's on me. Sorry about that. But that will be module 3. Module 4, this is what is going to be your final exam. These are going to be the chapters that go with that. So we'll have skin, musculoskeletal, endocrine, neuro, psychosocial, developmental disability, and sensory. That is going to wrap up module 4. And then there's the case studies that go with it. My course schedule, basically what's going to happen is we're going to have an exam every other week in this class. So week 1, and again, that's going to be Monday and Wednesday. We will cover communication, we will cover assessment, and then I will start on fluid and electrolytes. When we come in on week 2, I'm going to plan on doing your exams on Monday mornings. So I think we start at 10 on Monday, so 10 o'clock to 11 o'clock will be our exams. I will lecture those last 30 minutes, so do not plan on leaving campus after an exam. So if I got time, I'm going to utilize it. So I will go ahead and start in on chapters as soon as an exam is done. Now, week 2, if you remember, this is the week that we have a skewed schedule because I will be gone the following week. So basically what I'm going to do is cover week 2 and week 3 content during that week. The first week of April, like I said, I will be gone, so there is no pediatrics class. There is tons of stuff for you to do, and what I'm actually planning on doing is I'm planning on doing our donor drive that week. So you will have stuff that you will need to be doing. Week 4, exam 2, here it is. So we've got our chapters lined up for that one. It'll be on Monday, and then I will continue with chapters 46 and 47. Week 5, got quite a bit to cover. Week 6, there's another exam. Week 7, and then I typically will do your exam 4 during finals week. And then I will also schedule your ATI. I'm hashing out the final schedules for those, so I will get you those dates as soon as I can. Okay, here is the grading scale. So for pediatrics, basically all I do are exams and quizzes. That is what makes up your grades in here. So each exam is going to be your 20% of your grade, and then I will give quizzes. I typically give 5. So if I'm doing exams on Mondays, plan for quizzes to be on Wednesdays. Okay. If I'm giving an exam on Monday, I'm not going to give you a quiz that same day either. So let's just plan on exams to be on Mondays, quizzes to be on Wednesdays. All right. In order to pass, you must receive a 78% or higher in pediatrics. What you need to remember is this is team taught with OB. So that means that the 2 scores, so whatever you get in pediatrics, we will average with your OB score, and you will only get 1 grade for all of 221. But both your OB and your pediatric on their own have to be above 78% to successfully pass the course. Okay. Other things that we're looking at is you will have to get a satisfactory clinical performance also. So for pediatrics, our clinicals are going to be the egg extravaganza, which I will show you the grading criteria that we're going to use for that. I will do similar thing when we do our learning center visit to Robin's Nest. And then your third day is going to consist of your donor drive. And a lot of this is going to be from your peers. So your peers will kind of grade how you were as a chair for your committee, or how you did on your teaching performance, and then I will kind of be observing the dynamics as well. So that's what we're looking at for clinical. And then of course I will also have an ATI at the end. You must score at least a level 2 or greater to get out of this course. Okay, class attendance, like I said, class attendance is one of those things that you are expected to be there. If you miss class, you're going to miss a lot. So if you do miss, I suggest that you get with me, you get with your classmates to figure out what you did miss. And then we'll talk about if we need to address makeup work. Here's my policy on the exams. Like I said, there's 4 exams in this course. You guys have all taken exams by me now. You know I do mostly application-based questions. A lot of where we're going to talk about in here is going to be on communication, growth and development. We do a lot of that stuff in this course. Any grade below a 70% is an automatic failure for 221. If you miss my exam, so let's say that you can't make it for the exam, you will get a 3-point penalty, and then 1 point per day each day that you don't show up for the exam. So please try to be there on exam days. You don't want to take a penalty right out of the gate if you can keep from it. Quizzes, again, I'm going to plan on doing those on Wednesdays, but they can occur at any time during the day. There are 10-question quizzes. There are no makeups for quizzes, so if you aren't there for the quiz, you're going to take a 0. The community project, like I said, that is the egg extravaganza. I feel like we've been talking about this a lot, and Ms. Hampson and I will be meeting with you guys again and talk even more about the community project. ATI segment, stuff on academic dishonesty, professional behavior. I feel like I need to talk about professional behavior just because we are getting towards the end of this program. Keep in mind that we still expect you to be professionals. And we need to conduct ourselves in that, especially when we are going into these clinical sites. We're going into learning centers. We are going to be addressing the be the donor or be the match. that includes that you need to be professional at all times. Okay, we're going to be under a microscope from some of these people, and I expect professional behavior in the clinic setting, but I also expect professional behavior in the classroom. We are going to talk about some sensitive things in pediatrics, and I expect that courtesy to be extended to me and your fellow classmates. Okay, so just kind of keep that in mind. It's not usually an issue, but I still want to address it just in case. I believe that is it for this. So I'm going to go ahead and do a separate one for the Egg Extravaganza, the Robin's Nest Learning Center, and the Be the Match campaign. So if you guys have any questions about my syllabus, like I said, oh, I was going to talk about the Evolve case studies. The Evolve case studies, I am doing something different this semester. If you have been in there and noticed the Evolve case studies, there are 17 for pediatrics. What I had planned on doing was using them for extra credit for each module. So if you are planning on utilizing the Evolve case studies for extra credit, I will only use your first attempt. And you have to get, well, it's whatever your score is. You have to at least get a 90 for it to count for extra points towards your exam. And I won't accept more than 5 points for each module. So if there's 7, I'm only going to take, 5 of those if you got above 90%. I realize that's kind of vague, so I can kind of explain that a little bit more if you guys have questions, but you do not have to sit and do all the Evolve case studies at 90% or higher just to get out of the class. And then I don't want you guys sitting and scrambling at the very end of the program doing these, and that's what's holding you up getting out of pediatrics. So Evolve case studies, like I said, I'm planning on using them for extra credit. But again, I'm only going to use your first attempt at them if that's what we're going to do. So please, if you're going to do them, take your time, put the time in that is required for these. And then again, if you have any questions, I am more than willing to answer that for you. Okay, thanks.